42.5%, Andhra Pradesh has one of the highest rates of caesarean sections in the country as per the National Family Health Survey 5. This is behind only Telangana, where the rate stands at a whopping 60.7% as compared to the national average of 21.5%.
The World Health Organization says that the rate of caesarean section for any country should be within 15%. But in most parts in India, according to the National Family Health Survey, this rate is over 20 to 25%. The situation is particularly bad in Andhra Pradesh and Telangana, where the rates of caesarean section is over 40%. So Andhra Pradesh government has now taken this initiative where midwives are being trained to bring down the rates of caesarean section.
Now in Andhra Pradesh, it is this culture of unnecessary C-sections that is being targeted through a unique project called Seasafe. This project has been launched by the state government in collaboration with the Hyderabad-based Fernandez Hospital Educational Research Foundation and the University of Birmingham, UK. Supported by the WHO and UNICEF, the project aims at ensuring that these surgeries are done for only the right reasons by introducing protocols for this procedure and sticking to the algorithms as per the guidelines by the Union Health Ministry and the WHO.
We are standing outside the district hospital in Tenali, which has been chosen for the pilot project.
But the things that we're looking at is promoting physiological birth, because we know that that is not always done in the best way, and we're also trying to rationalise the use of caesarean sections as well as make them safer. So Seasafe is working in three ways. We've got three arms, if you like. So firstly, let's take scene on, and that's the physiological birth promotion. So it's not just looking at spontaneous vaginal birth, it's also supporting assisted vaginal birth, so vacuum and forceps. Then we've got CY, which is looking at the reasons why caesarean sections are done. At the moment, there is a great classification system that's used around the world called the Robson's classification system, and that tells us in who caesarean sections are done, but there's no uniform system that tells us why caesarean sections are done. So we have created the CY classification system with our partners at WHO, UNICEF, various academic institutes around the world, the Royal College of Obstetricians and Gynecologists, the Royal College of Midwives, and we've come up with this classification system that allows us to put all of the reasons for caesarean sections into a chart, and the chart helps clinicians to be able to select which is the most appropriate caesarean section reason.
To start with, the district hospital in Tenali in Guntur district has been chosen as a pilot site for the project. Over the next few months, the initiative will also be taken to the district hospital in Anakapalli and government general hospitals in Raja Mahendravaram, Machilipatnam and Eluru. Officials associated with the project told us that as a part of this initiative, a safety bundle for C-sections is being developed. It will then be field tested and evaluated through a stepped wage cluster trial where intervention is introduced in select parts. Findings from this initiative will then be examined for clinical and cost outcomes and will also be presented to the Union Health Ministry. The initiative is being championed by specially trained midwives who have been trained as per the International Council of Midwives standards over an 18-month course. The course has been facilitated by Fernandez Foundation along with other partners, and it has seen the recruitment of midwives by state government in various hospitals. In Tenali, where nearly 250 to 300 childbirths are seen every month and C-section rates are as high as 50 to 60%, the initiative holds a huge promise.
Previously we used to have higher C-section rate at our facility and in our state, that is more than 60%. Now with this project is being started, 6 months back midwifery trainers were placed in this facility. They are on this job and they used to motivate the pregnant women in OP during OP registration, and to motivate them with conducting antenatal exercises and advising to take nutritious diet during the antenatal period, and they are able to conduct normal deliveries for the cases. And training is being held in our facility since a week, where the Birmingham master trainers and trainers from Fernandez Foundation were here. They are training our doctors, staff nurses and other midwifery staff to conduct normal births and to practice safe C-sections at our facility. With safe practices, there will be reduced infection rate and reduce the morbidity and mortality of the pregnant women.
Yeah. So what is the C-section rate in this particular facility for maybe say over the last 1 year, and how much are you hoping to bring it down to?
We are planning to bring it down to less than 40% at present. We can't do in a day or a few days, but it's a long time. It might take a long time, because the public should get awareness, and they should cooperate with our medical personnel and obstetricians.
Research studies show that a professional midwife trained to global standards provides continuity of care throughout pregnancy and childbirth. It also has the most significant effect on reducing the number of planned cesareans and the overall C-section rates. The midwives we spoke with and the master trainers say that they have been taught to provide compassionate care for childbearing women, newborns and families. And the care continues throughout the pre-pregnancy, pregnancy, birth and postpartum period.
Women who have births and looked after by a trained professional midwife have reduced maternal mortality and morbidity, introduced positive birth experiences, and reduced unnecessary interventions such as cesarean section rates. A cesarean section, when indicated, is needed. However, in our state of Telangana and Andhra Pradesh, we've got one of the highest cesarean section rates in the country. The program and the project that we're doing, part of the interventions is through midwifery, that we will reduce the cesarean section rates with the interventions of midwifery, because midwives have been trained to look after women without medical complications, and they work collaboratively with obstetricians for women with medical complications. The scope is very clear. Midwives will not do cesarean sections or normal births. Midwives also have no time limits. We've been trained to look at birth in a physiological manner. However, obstetricians look at birth as a medical interventions. So it's really important for the team to collaborate and to work towards improving outcomes for women and newborn.
While reducing non-essential cesarean section is the primary aim of the project, it is also looking to promote best practices during the surgeries for childbirth that may be absolutely required. Also, the focus is going to be on encouraging assisted vaginal births using instruments such as forceps and vacuums when indicated. The idea, according to those associated with the project, is to reduce morbidity and mortality associated with childbirth through teamwork and communication in a high-stress setting such as operation theatres.
Women in low and middle income countries in lower resource settings are at a higher risk of dying following cesarean section. About 50 to 100 times higher risk of dying than women in high income countries. And a lot of challenges related to that are around providing that safe cesarean section. And what we're doing in programs, and I've done this, we've been doing this for like 10 years for focusing on safe cesarean section, is really to make sure that the best evidence, the global recommendations, are being integrated into programs in all countries. And examples of that are use of the WHO surgical safety checklist, which has been shown to decrease perioperative complications and deaths by 30 to 50%. And same with focusing on infection prevention practices that have been shown to decrease surgical site infections by greater than 50%. So those are the things that we're focusing on, as well as evidence-based surgical techniques. But a big thing also is not just on those areas, where so infection prevention, kind of bundles of care, managing or preventing and managing hemorrhage at cesarean section, and surgical techniques. But the other part is really around strengthening teamwork and communication, and that is huge. Especially in a high stress environment like the operating theater, it's so important that teams communicate and work together very, very well. And we've seen that by doing that, you actually decrease complications by around 50%. And in our programs, we've seen a decrease in cesarean section related mortality